I'm the nurse practitioner for the McCarthy Care Center and head of the Quality and Education Division of the VNA of Cape Cod Hospice. The role of the nurse in hospice care is really to be sort of the coordinator of the team of people that are helping the patient and family cope with all of the things that come with serious illness. They work in collaboration with medical social workers, chaplains, hospice aides, volunteers, music therapists, pet therapists, all of the services that are encompassed in hospice care, which really differentiates it from other types of care that we receive. I have goals of care conversations that start out by finding out what the patients and families' goals are, and then integrate my knowledge of the disease processes and the trajectory of these illnesses, and so that we can come to a common understanding about what the goals of care are and to honor their goals with dignity and empathy and to communicate that to the team. When you elect hospice care, you're electing a philosophy of care that says, despite the best medical efforts, we can't turn this illness around, and so now the focus will be on comfort. At some point, we will find ourselves facing serious illness that, despite the best medical efforts, cannot be reversed. And I hope at that time I'm offered the same thing that I've had the opportunity to offer other people, which is there is a way to provide care that not just cares for the patient's physical needs, but emotional, spiritual needs that extends to the families that are also impacted by it. At the VNA of Cape Cod Hospice, I truly, truly believe down to my toes that the care we provide leaves people in a better place than before we entered it. I think oftentimes people think of hospice care as a person who is dying. But hospice care, and if you ask any person who works in hospice care, they would say what I always say, which is people will die, but every day before that day, they're alive. So we care for the living who are experiencing the impact of serious illness.